Yeah, this year for the highlights or the best of year in review, heart failure in 2014, the first study that I talked about was the Paradigm HF trial. This was a trial that was comparing a totally new class of drug called a neprilysin inhibitor combined with an angiotensin receptor blocker as compared to the traditional therapy of enalapril in patients with low ejection fraction heart failure. And this study by far was the most exciting study of the year because it showed a statistically significant improvement in every one of the outcomes that they were studying, heart failure hospitalizations, overall mortality, and heart failure mortality. And this was the first drug ever to show that it was superior to enalapril and clearly will be a new era in heart failure management with oral medications. In addition, the drug was very well tolerated as compared to enalapril, and many of the side effects, including angioedema that people were concerned about, were not seen when the trial was completed. So that was the most important trial, I think, of last year. The next trial that was discussed during the session was the Confirm HF trial. This was a clinical trial looking at the use of IV iron in patients who were iron deficient and had heart failure. There had been several other studies looking at iron and erythropoietin that had not turned out to be positive. This trial was looking at functional capacity, patients' ability to walk for 6 minutes and comparing that distance over time after receiving the intravenous iron or placebo. And this trial did meet its primary endpoint of an improvement in 6-minute walk distance and also improvement in quality of life for the patients. And there clearly also was a trend in reduced heart failure hospitalizations. So this trial also met its primary endpoint and again gives us a new therapeutic target in heart failure going forward over time. The next trial that I reviewed was a device trial. This was the long-term follow-up of the Made It CRT trial. This was a trial that originally was designed to look at the use of CRT, cardiac resynchronization therapy, in patients with low ejection fraction and left bundle branch block, and to look at mortality with mild heart failure. And the original trial that had a median follow-up of about 2 years showed a statistically significant improvement in mortality, and the trial was extended out to 7 years to see if that persisted. And this trial also met its primary endpoint in showing a reduction in mortality at 7 years. Patients did extremely well with the CRT therapy. But like other trials, this trial was only positive in the patients with left bundle branch block. Patients that did not have a left bundle branch block did not seem to get the same mortality benefit. So that was the breakthrough in device therapy this year. The next trial was a negative trial. This was the Topocat Trial, which was looking at the use of spironolactone in patients who had normal ejection fraction, or what we call HFpEF. These patients were randomized to receive spironolactone or placebo, and this trial did not meet its primary endpoint for reduced hospitalizations or morbidity and mortality. There were subgroups, certain regions of the world, where the drug behaved very differently, so that was certainly hypothesis generating, but the overall trial, their intention to treat analysis, turned out to be negative and was a big disappointment because we don't have many therapies for diastolic or heart failure with preserved ejection fraction. The next trial was a trial called Nectar HF. This was a trial that was looking at a vagal nerve stimulator to do kind of neuromodulating therapy for patients with heart failure. There have been a number of these trials done. This trial was looking at a novel device stimulating the vagus nerve and again did show some improvements in quality of life, but their primary endpoint was change in echo parameters, change in left ventricular end diastolic dimension, and unfortunately that was unchanged. So although patients subjectively felt better, they did not see the echocardiographic changes that we were hoping for. So this is still an area of active investigation, and I suspect there'll be more trials along those lines. And then lastly, the last trial that I reviewed was a gene therapy trial. This was the long-term follow-up of the Cupid trial. This is a trial that gives gene therapy to increase intracellular calcium in the cells of the heart, or SERCA2a. The original trial had 38 patients in it and was positive and was a very exciting trial. This was the long-term follow-up looking both at efficacy and then also at long-term safety of gene therapy in this population. And this trial did meet its endpoint where there was ongoing benefit both in heart failure as well as in mortality and an excellent signal for ongoing safety. Very few issues are related to safety in the long-term follow-up of the Cupid trial. So together, these trials really focused on medical therapies, device therapies, and gene therapies, and all of which were very active in the last year in heart failure. Many were positive, and we anticipate that the neprilysin inhibitor angiotensin receptor blocker combination will ultimately get regulatory approval, and we'll be incorporating that into our guidelines and learning more about the subgroups of those studies, and the continued expansion of the use of biventricular pacing clearly validated by the MADE-IT trial. So it's going to be a very exciting couple of years from the trials that were presented in the past year.